FOCCAD is a Malawian not-for-profit organization who focuses much our work on health at community level. Currently, Malawi is around between 6 or 9% HIV infection rate. We have dropped from around 16 or 7% way back in the early 80s and 90s. We still have new HIV infections among adolescent girls and young women, especially key populations, female sex workers. These adolescent girls and young women who sell sex. These are highly stigmatized. They are facing punitive laws and policies that scares them away from accessing HIV testing, treatment, care, and support. So this is a population where FOCCAD focuses much our work on to make sure that no one is left behind. Our ViiV Healthcare funded project is focusing on 3 levels of change. We are scaling up provision of targeted and one-on-one and small group HIV and AIDS information. This is using peer leaders, sex workers and friends as peer leaders to reach fellow adolescent girls and young women. We are seeing a lot of strides using this level of change because over 5,600 adolescent girls and young women who sell sex have been reached by their peers. The second level of change is where we're focusing on scaling up active index testing because this is a group that is not tested for HIV because they are scared away because of policies, stigma, and other attitudes that happens among them. So we are making sure that we target them through moonlight testing. So the third level is where now we are addressing the negative policies and laws that scares them away from going to the healthy facilities. We've used an approach called social contracts, where there's an agreement between the service providers and the adolescent girls and young women to make sure that the healthy facilities becomes a safe space. Our challenges before were that this type of population cannot go to the healthy facilities because of stigmatizing attitudes of health workers. So we are taking interventions directly to them by conducting testing at night. By doing that, we are also reaching the adolescent boys and young men who are the clients and customers of these female sex workers. To end new HIV infections in Malawi, we need to focus on adolescent girls and young women. It is a key population group that is faced with key drivers to HIV infections because as they grow, they become sexually active. And then we need more new HIV prevention interventions while we are focusing on treatment, care, and support as part of combination HIV prevention interventions.